Hi everyone, welcome to week 9 of your Medical Insurance for Pharmacy Technicians course. This week we are going to be covering chapter 7, which is on processing claims and appealing decisions. So make sure that you review the first several slides with all the different learning outcomes and the key terms. So let's take a look starting with slide 6. We have a number of criteria that have to be met in order for the payer to provide reimbursement for a prescription. And so during that whole process, that process of reading the prescription and processing the claim and approving it is called adjudication. So if we have everything fine, we're going to get a notice on our computer screen that tells us what the prices of the medication, what the patient's copay or coinsurance might be, and things like that. However, if the claim is not approved, we're going to get information about why not. So it's going to give us information about what did we do wrong and what edits do we need to perform. Now keep in mind, I mentioned this before last week, that anytime you submit an edit and you go back and forth, we have to pay something called a switch fee. So we want to make sure that we limit the number of edits that we do. So we want to be very careful with entering information. So make sure that you're entering, the patient's information, the birth date, their person code, things like that. Make sure you're entering that accurately, and that will help reduce the number of edits that you might have to do. And basically those edits are grouped into two buckets, administrative edits and safety edits. So usually administrative just means we need something else in order to be able to finish the claim, or something's been entered incorrectly, whereas safety edits means there's some sort of concern in regards to the prescription as far as health risks and things like that. So these are just some of the categories for administrative edits. Eligibility is where that whole idea of person code, birth date, that type of thing, that will fall into that area. Dosage checks. Did we put in the right dosage? Did we put in, instead of BID, did we put QID? And that medication's never given in that dose, and so it's saying, hey, wait a minute, take a look at this again. Did we already submit this claim once before? Does this look like a duplicate claim? Are we trying to refill it too soon? What's going on with it? So those are some of the things that fall under administrative edits. Under safety edits, this is where you're going to see things like drug-drug interactions, age or gender contraindications, days supply being incorrect, a therapeutic duplication, those types of things. So it will come back and tell you which bucket it falls in and what exactly is the problem when you go to submit that. Remittance advice is the document that's sent from the payer to the pharmacy that explains what action was taken. So it's going to give you the results of that adjudication. It's going to tell you how much is going to be reimbursed and things like that. You're going to get both electronic and or paper, but they look very similar. They have similar information, but they're going to look somewhat different, obviously. Adjustments is when the amount that is charged is not equal to the amount that's paid. And so when those adjustments come through, they're going to tell you what is that adjustment, what does it represent, what are those codes for, and what does it all mean. So that's what the adjustments section is all about. Of course, most pharmacies are going to collect some sort of payment. So they're going to tell you whether or not you're doing a copay or something like that, or if the patient has to meet a deductible first, that kind of stuff. And then, of course, if you're the person who is working with the insurance on a regular basis, internally you're going to have to do account reconciliation. But what that means is making sure that the reimbursement and then what you get from the insurer and from the patient, all of those things balance out. Now, a lot of that's done automatically in many pharmacies. But if you're in a small pharmacy, maybe a privately owned, something like that, that may be something that you're responsible for. And then, of course, there's going to be a process for resubmitting and appealing a claim if for some reason something was rejected at the end, that type of thing. So as you're going through and reviewing this chapter, if you have any questions, please make sure that you reach out to me, and have a great week.